Almost nothing is as devastating as receiving a cancer diagnosis, but unfortunately, 1 in 9 men will be found to have prostate cancer. Dr. Stephen Finkelstein is here to discuss what we need to know. Doctor, thanks for joining me.
It's a pleasure to be here today.
So I said 1 in 9 men will be found to have prostate cancer, but give us a little bit more on how common it is to see this.
Yeah, so prostate cancer is the most common non-skin cancer in American men. In the United States, about, as you said, 1 in 9 men will be diagnosed with prostate cancer at some point in their lifetime. The good news is that prostate cancer is highly treatable, and there are several treatment options available based on the patient's age, their health, and their personal preference. I'm excited to talk with you about these treatment options today, and that's why I'm so pleased to partner with Boston Scientific on this educational campaign.
So in order to even get to treatment, you have to, be found to have it. You have to be screened. So when should men actually take this step?
Deciding to get tested is a personal decision, and it should be made after consultation with a doctor. There's some important factors to consider as a patient: your age, your family history. Detecting prostate cancer early gives you as a patient the best chance of living longer. In fact, more than 99% of men survive prostate cancer when it's caught early enough. In my own personal experience, my own father was diagnosed with prostate cancer 10 years ago, and he received radiation therapy. And I'm happy to report he's doing very well.
That's great news. It's great to have that attention when it's needed. And tell us a little bit about the treatment options and if there have been sort of any recent advances.
Yes, there have been recent advances. Treatment options for prostate cancer include active surveillance, where we monitor the cancer and do consistent testing to see if symptoms will change over time, or surgery to remove the prostate, or radiation therapy to shrink it. And each of these techniques has its own risks and benefits. Interestingly, the most common approach for older men is radiation therapy. And many of my patients are often concerned about potential side effects. What I tell patients is that in order to reduce the risk of potential rectal damage associated with radiation therapy, physicians can use something called space OAR, hydrogel, that creates a temporary space between the prostate and the rectum. The presence of this gel, which is inserted via a minimally invasive procedure prior to radiation therapy, is designed to reduce radiation dose to the rectum.
And the big question right now is, people are sort of putting their medical needs on hold, which is something they shouldn't do. But is it safe for men, just to, give them another perspective, is it safe for men to visit the doctor right now to discuss prostate cancer treatments?
Now, clearly, 2020 is not the year many of us expected as physicians and patients. Now, physicians' offices and hospitals have begun taking extra precautions due to COVID-19, and many locations have safely resumed elective procedures. Talk to your doctor about the precautions they are taking on site, and together, you as a patient with your doctor should determine the best time for you as a patient to receive therapy and hear about therapy. My own personal experience is that patients have been seeking and patients have been receiving care just fine.
Good reminder. Doctor, if we want to learn more information, where can we go?
For more information, for those who are discussing radiation as a treatment option for prostate cancer, you can go to spaceoar.com, a resource provided by Boston Scientific.
Very good. Dr. Stephen Finkelstein, thanks for your time.
Thank you. Absolute pleasure today.
You too. And stay where you are. We'll be right back.